The Achilles tendon is one of the strongest tendons in the body. It basically requires the strength to take our entire body weight, and it goes to one spot right on the back of our heel. And so the stress to that tendon is greater than any other tendon in the body. It's the body weight going to this one area. Because of that, it's prone to injury. And so we'll see patients that have been going out, they go out and they play basketball every weekend. And they might be in their 50s, they're what we call weekend warriors. They say, I'm gonna go play basketball with my friends. Maybe they didn't play for a while. Maybe they forgot to stretch before they went out and played, and they go up for a layup, and they feel like someone kicked them in the back of their ankle. They might even hear a pop. They turn around to see who kicked them, and there's nobody there. And the reason is that their Achilles tendon has ruptured. We see it very commonly, again, sort of that middle-aged male is most common, but it can happen in men and women. It can happen in young athletes. I've seen it as early as 16, 17 years old. But as we get older, our tissues don't quite accommodate to quick start and stop activities like basketball. The pickleball craze has been really interesting in the Achilles tendon world because patients may have been a tennis player for many, many years in their lives, stopped playing tennis 20 years ago, and their friend said, hey, let's go play pickleball. And they go play pickleball. They've never done it before. It's a new sport. They didn't really stretch before they got on the court. Again, typical injury pattern. They might take a quick step. They hear or feel a pop. They look around for who hit them with their paddle or their ball, and there's no one near them. And again, they've sustained an Achilles tendon rupture. Some of these patients can be treated conservatively, but for the most part, most patients end up needing an operation. When we fix these surgically, we basically take the rupture, which occurs somewhere between the heel and the muscle, which is about that far. One of the reasons that the Achilles tendon does rupture is that it doesn't have a great blood supply, and so that's one of the reasons why they'll occur frequently. And so we basically make a small incision, and then we use suture to go between the two ends of the tendon. We put the ankle down a little bit flexed so that the toes are down a little bit to take tension off the repair. Once the stitches come out, we'll put them in a removable boot. The boot has a couple of wedges to basically allow the ankle to tilt down a little bit. We'll have them start range of motion exercises out of the boot very quickly. We'll have them start removing the wedges in that boot, and then eventually putting weight back on the ankle somewhere around 4 weeks after surgery. At 6 weeks after surgery, they're walking in the boot pretty comfortably. They start physical therapy, and then after 12 weeks, we can usually take them out of the boot. The one challenge with Achilles tendon ruptures is they don't get back to sports quickly, which is frustrating for patients. But even in professional athletes, pro athletes can rupture their Achilles tendon and sometimes not get back to the playing field for 7 to 9 months. Unfortunately, the weekend warriors have the same issue. They aren't doing physical therapy 24/7, they're doing it twice a week, but they too can't get back to playing basketball or tennis or volleyball until around 7 to 9 months from surgery. It can even take 12 months for that strength to come back completely. And so it's not a quick fix. It does require patience, which in some athletes, even young and old, is challenging, but we do encourage them and we bring them along slowly and steadily.